Apologies that you are not able to see our faces in the room, but we can see you if you have your camera on, so it is nice to meet you. I am going to be able to kick off. We might have some folks join us in the room or online as we go, and that is totally fine. In the meantime, let me grab my script for our public meeting. I'll go through my spiel to kick us off. All right, it's June, y'all, which seems wild. So this is our June 2026 meeting of the Community Health Advisory Council. My name is Katie Plum. I chair this group and will walk us through the agenda today. The Community Health Advisory Council is established in Oregon law and instituted locally here in Crook County. Community Health Advisory Council, also known as CHAC. We provide recommendations to the Crook County Board of Commissioners regarding public health and behavioral health issues here locally. These meetings are an important opportunity for partners in the community to work collaboratively to support the health and safety of Crook County. Please note that this is a public meeting. We do not have a designated time in the agenda for public comment, but if members of the media or general public have questions or comments, please reach out directly to an appointed chat member or a staff member outside of this meeting. We will move forward with member roll call. When you're called, please let us know you're here. After roll call, we'll go through and have introductions of anyone that's joining us today. Let me see if I can remember this. I will start with Devin.
Hold on, I have to unmute you guys.
Oh, we're trying not to get hacked.
I'm here.
Evan is here.
Kimberly. Here. Oh. Is Bill joining us today?
No.
Courtney? Yes. No. Emily?
No.
Audra?
No.
Grant?
Here.
Grant's great. Hi, Grant. Liddell?
No.
Hope?
No.
April?
No.
Erica?
No.
Me? Katie? I'm present. Did I miss anybody?
No members.
All right. Thank you. And that will next go around in the room and do introductions. Then we'll jump online and do introductions of folks joining us virtually. Steph, do you want to start us off here?
Sure. I'm Stephanie O'Neill. I am the Public Health Modernization Manager. I supervise prevention, health promotion, and emergency preparedness and response programs. And what was the other question? That was it.
And graciously taking notes for us today.
Yes, taking weird notes.
I'm Shelby Fisher, Chief of Pronouns, and I work in the Prevention and Promotion Department with Stephanie and Katie, and what's okay. My new friend Martin, she, her. I also work in the prevention and promotion program for the lovely individuals, not to go through them all. And I'm also the public health emergency preparedness agent for account company.
I'm Courtney Barassa. I am a non-self physical therapist here at St. Charles. I'm representing us community member.
I'm Kimberly Muck. I am the Chief Nursing Officer at St. Charles over Mattress, Prineville, and Redmond.
Katie Plum, I'm the Health and Human Services Director for Crook County, and I'm earlier chair at the Community Advisory Council.
And I am Alexandra Greenberg, and I work on the prevention and health promotion team for the Crook County Health Department.
Alex, I'm gonna let you orient us online.
Okay. Grant, we'll let you go first.
Grant Havel, Crook County Special Ed Director for School District.
Sorry, I know that's hard to hear everyone. All right, Angela.
I'm Angela Cumming. I'm the program director for Best Care in Crook County.
Can you guys all hear them?
It's like a whisper. We're having a little bit of sound issues in the room. It's hard to hear you all. We'll try to make some adjustments. But hi, Angela. I can see you.
And Mike.
Yeah, Mike Case, and I'm the program manager for the IDD program in Crook County through Best Care.
He's the program manager for the IDD program in Crook County through Best Care. Rita. Hold on. There we go.
Here I am. I'm Rita Roden, the perinatal care coordinator with Crook County Health Department and CHW.
It has to be Teams to connect to the system. Yeah. Devin.
Hi, Devin Nelson Harmon, Program and Community Manager for NAMI Central Oregon, which is the National Alliance on Mental Illness.
Thank you. Haley.
Hi everyone, Haley Morris, overdose prevention at Crook County Health Department. And yeah, apologies for being camera off today.
It might be our settings too, Haley. I think I turned it off and those three just happened to turn theirs on before I turned the setting off.
Gotcha. Okay, thank you.
Yep. And Shelby.
Hello, I am Shelby Shuppies, she, her pronouns, and I'm with Data to Action Oregon, which is a NIDA-funded research project understanding data use related to substance use and overdose prevention. Thank you.
Thank you. And Camille.
Good afternoon, everyone, or good morning still, I guess. Camille Day, Crook County Deputy Director for Health Department.
And then for those of you online, we just had Audra walk in. She's one of our members. Do you want to introduce yourself, Audra?
The ears, where the that's my ears.
That's okay.
Fair. I think we will.
Oh, and Erica's just about to join us.
We will need to do some adjustments to see if we can change the sound settings to connect to the speakers, but because we have presenters who are online and we're not going to be able to hear them. So I don't know if there's a St. Charles type person that could help us with that.
I already had someone in here and they said there's nothing we can do since it's not on Teams.
Right, we will do our best, but it is definitely going to be a challenge to hear what's online. Okay, next on the agenda is if any of our appointed members have announcements for the group. This item is for you.
Also, welcome Erica. She just joined us too.
Join us.
Can I unmute you 1 second, Erica?
Hello, good morning. Sorry, I don't know. I can't turn on my camera or my mute or any of the things. So.
I know we have all those settings turned off to prevent things that have happened in the past. And so I apologize.
Completely understand.
Yeah. Oops, sorry. You don't have to.
Okay, if any members have announcements that you would like us to document in the meeting minutes, you can also put them in the chat. I believe there's chat access.
Yep.
Okay. All right. Any staff announcements from public health or behavioral health? folks. Hi, well, welcome.
Announcing that I'm the last one to show up.
You're okay.
I've already prefaced that we have people trickling in. Glad you could join us. I have some notes about staff announcements around summer events.
I also just joined.
I can share that public health folks will be at the Crook farmers markets to dole out WIC farmers market checks and promote OHP assistance that will be helping people on site at the farmers market with OHP enrollment or related questions. So that'll be coming up on, I think those are on Saturdays. Right.
And then we also will be participating in the Prideville event on Sunday, the 29th of June. And then the event that we have after that is County Fair. And so far, that's what we have lined up for the summer events.
And then I'm not seeing any other staff folks online with updates, but I do have a note that we're working on the progress report for the fair access plan, fair access to health plan for the county. And then we'll bring that back to you all in August for a report out on how on progress we've made with that work plan.
We'll be at Mosaic will be at the Prideville also, and then we're gonna Crook. I don't think you guys do the Chamber of Crook on the 24th of July. If anybody wants to stop by, have them coffee and then you take them.
I do have an announcement I can share. This is Courtney. I just got a notification last week that I received a caretaker grant through the hospital that will allow me to put period kits into the elementary needs schools. So I'll be working that this summer. We need help distributing.
Very exciting. I know that the library has recently pulled together some I'm not sure what they're calling it, but for free period products.
PM3.
It's exciting. Any other member or staff announcements?
I got invited to the maternity care access. The state convened a group together, and several county commissioners were there from counties that don't have any maternity health care. Our county wasn't represented, but like Baker City was, so Baker City. Anyway, there's a group really trying to bring attention to maternity health. So we are looking to create a little just enough to figure out how we can help support to bring more services to it. So just nice.
This is good news. It's all stuff that when we talk about access to care, we've identified as some gaps. So that's exciting. All right.
Camille left the meeting, so I'm not sure.
She's on her way here.
Okay.
All right. Angela, we have you up next, and I mentioned earlier, sound is really quiet here in the room, so if you can use your outside voice.
Most people don't have problem hearing me. Can you hear me okay?
We can. It's
sort of.
It's all on our.
It's all. The sound is coming from my laptop in an entire conference room. So
okay.
Yeah, but project as loud as you
loudly
can.
as I can without disrupting like the people in the offices right next to me. So if y'all can hear me talking, I have to talk loudly because of a meeting I'm on. But can you hear me okay when I talk like that?
Yeah,
Do I need
we're
to have the Zoom app or can?
we're working on another option, Angela, to be able to, but we can't really have. Oh, actually,
I can mute my laptop and
Yeah.
someone's phone could possibly be
I could
louder.
call someone's phone.
I think speakerphone would be louder.
We're gonna try having someone join the meeting with their cell phone
Okay.
and then try to have the sound on a cell phone instead.
Okay, so I should just wait just a minute.
Yeah, it'll be.
Yeah, just 1 second. Sorry,
Okay.
everyone. Just don't trip over those, please. Sorry, Nicole. If we get on a phone, I can go back to my corner. Well, there's no tripping hazard then. You need the meeting ready and stuff? I can share it. Tell me what you need.
Someone read me the passcode.
The passcode is 982409.
09.
Yes. I got.
All right, try talking now.
Does that
Much better.
Yeah, you can hear me?
Yes.
Okay. So I should start talking now?
Yep. Yes.
Okay. So we don't have a whole lot of news on this end. But there is a big announcement that I am going to be transitioning positions. I have been I will become the new Chief Behavioral Health Officer for Best Care. The hope is that I will start in my new role in July, August at the latest. So we are currently recruiting for my position and have our first interview for that this week. So hopefully we will know soon who will be replacing me. But I will be moving into that role with Best Care, which I'm very excited about. So that'll be a big change though, because I've been the director here since Best Care took over in 2019. So there is that news. And then the only other thing is we still do not have a signed contract with Pacific Source. Our current contract is up at the end of this month, so I'm sure it will be signed before the end of the month. But negotiations have been going essentially what I shared at the last meeting. It's not really much of a negotiation that's happening. It's just kind of, this is what it's going to be. There's really nothing new to report there. But as far as Best Care goes, those are the biggest updates that we have.
Well, congratulations, Angela.
Thank you.
That's very exciting. And we will look forward to hearing who will join us in your role and look forward to meeting them. Anybody have questions for Angela or anything else Best Care related?
My computer is muted and I turned the volume down completely. I don't know why it's still getting sound.
Yes, I have a question. So with the Pacific Source contract being worked out, and you kind of already know they're saying this is how it's going to be. Do you know if that's going to include OHP? Will you guys still be able to see OHP clients?
Well, Sorry, I'm going.
Yeah, we'll still be seeing OHP clients, because I mean, we will sign the contract. It's just at the end of the day, it is going to be cuts. And so us determining, what that looks like with regard to, what kind of services we may have to cut. We are still kind of figuring that out, but we will still take OHP clients. I mean, we're not going to deny folks walking in the door, because that's what we receive money from OHA for, is things that aren't covered, by insurance. Here's a chunk of money to be able to continue to provide those services. It's just, we don't get enough money from OHA to make up for the cuts that we're having with Pacific Source. So, there's just been some discussions about what will that look like. And I don't have an answer for that yet, as far as what might get cut.
So Angela, you can correct me if I'm not capturing this correctly, but the negotiation is over what Pacific Source will reimburse Best Care for the services for OHP clients. It's, but
Correct.
in order to serve OHP folks, that contract does have to be in place to get any reimbursement.
Correct.
Yes, yeah, that's right.
Okay.
Yeah, the negotiate, I mean, it's rate cuts. They're doing rate cuts across the board. And you know, there was a hope amongst the CMHPs that, that it wouldn't impact the CMHPs because of the care that we have to provide. But it is impacting the all three CMHPs in the Tri-County. So, yeah, there will be cuts.
All right. Any other updates from Best Care?
I think that's it. I mean, for those of you who don't know, I mean, this isn't really Best Care Crook County, but it is Best Care. We did the groundbreaking, for our new Latino residential program in Madras. So that is now underway with construction. So that's exciting. And I see that Rita's got a question.
Go for it, Rita.
Thank you. So I recently have had a couple of clients that have lost OHP and are concerned about still getting their services. How can you explain like how you work like on a sliding scale, or for people that are without health insurance currently due to being a little over income?
Yeah, so we do have a sliding scale, and it's simple. They can just come in and meet with Brandy or Ashley. Those are the folks who determine, you know, where somebody would fall on that scale. And then, I mean, we have some people who, you know, I mean, it's as low as $10 a session to come in. So they just have to, I mean, and don't quote me, because I mean, I'm not the one who does this, but I mean, I'm pretty sure that they bring, well, I don't even know if we ask for proof of income. I'm honestly not sure how the process goes, but Brandy and Ashley. So we do have a sliding scale.
Okay. Yeah, I think I have a couple clients just avoiding going, and I keep encouraging them to go work out a payment plan. So
yeah, we definitely have that option for folks. So rather than not come, I mean, they can even call up here if they don't want to come down here and ask to talk to say, hey, here's where I'm at. Where would I fall? If they're worried about maybe I would get charged just to go talk to somebody, which they wouldn't.
okay.
But they
Okay,
can
good
always
to know.
call too.
Perfect. Thank you.
Yep.
Thanks for that, Rita. I have a feeling we're going to have more and more folks in that space of being just over income for OHP. So thanks for asking that question, and Angela for clarifying. All right, next on our agenda, Camille, thank you for coming down so that we can hear you. We did work out a little bit of a workaround to get a little more sound in the room, but appreciate you being here. Camille is the main point of contact for Rural Health Transformation Program funds that have been invested directly to local public health across the state. So there is the Rural Health Transformation Program across Oregon is in the middle of I believe their application process just closed last week, maybe.
Yeah.
Where it was open to basically anyone to apply for those grant funds. This is a carve out that was allocated directly to local public health authorities. So Crook County has received funding, and we have proposed a work plan that I'm excited to share aligns with the work plan that we've put together for the Community Health Advisory Council. And so that gives us a little bit of one, dedicated staff support for the work that we're doing as a group, and some leverage points that we can hopefully then make additional movement in the plan that we've set out and identified as a community. So I'm going to let Camille just give an overview of, we still have to wait for approval for our work plan, but this is what we've proposed. And the funding is in the contracting process with the county right now. I presented it to the commissioners last week, and then it'll go before the Board of Commissioners for adoption this Wednesday. So the funding is moving, and we're just waiting on the green light for our program plan to be adopted. But this is what we're proposing.
Okay, my turn. So we have a few different activities that we're hoping to do with this plan, or a few objectives. The main goal is to connect people with social health needs in Crook County, so Crook County residents. One of the ways we hope to do that is by building like a more universal resource hub on our website or in our newsletter. So that's an area that we were hoping that maybe chat could help, because we have a lot of community partners at that table discussing that. Another thing is that we want to make a community health worker meeting. You know, we want to bring all of our community health workers together in Crook County so that they can collaborate and support each other. The second part of the grant is to do pregnancy classes. So we're working with Rita, our PCC, who's online, to develop a pregnancy kind of plan. Like, what do you do? You're pregnant, prepping for baby's arrival. We're gonna hopefully have a few different community providers involved in this. Already have had some involved in the process wanting to participate. So pregnancy resource classes, they'll be for 4 weeks, and we'll have 3, 1 in September and then 3 starting next year. The other
next fiscal year. Correct.
Yes.
Yeah.
Yes, next fiscal year. The other thing that we're trying to work on is how do we reach people that aren't in the pregnancy population, maybe an older individual. So having some gatherings where we invite community programs to come and present what resources they offer. So we're going to have some other more general gatherings and some advertisement for those, and then building up some structure for CHW billing. So part of this grant is making sure that it's sustainable, it can continue. So how do we ensure that we can still provide these classes once this funding is over? And then Katie's going to touch on the veteran specific. I'm sure I missed so much.
It's a good overview. Yes.
And just to chime in real quick, Shelby said that Lincoln County has a CHW meeting and pregnancy classes, if it would be helpful to chat with them.
That would be excellent.
Thank you, Shelby.
Yeah.
So really the goal is, when we identified all of those kind of gaps in services, or hey, there are resources, but they're really hard to navigate. So transportation is one of those, that there are some transportation resources, there's gaps in them, but there's also challenges in people even getting connected with those resources. So the idea is to hold those community convenings that increase health literacy and health resource literacy of what are the resources out there and how can we use them? And that is open to everyone in the community, not necessarily, just we have the perinatal population. They would be welcome to come to these too, but this is a broad community resource. And then we're directing some funding to veteran services to do some very direct outreach to veterans around what their social driver needs are, whether it's food or transportation or we get a lot of requests for like home health care and connecting them to those resources. So some of these funds will go specifically towards community resources that are available to support veterans and their families. Are there questions or immediate thoughts about that body of work while we have Camille here? Alex, are you going to be, or would you be able to pull up the CHAC work plan for folks online? Okay. So we're gonna shift, and hopefully with rural health transformation programming in mind, when we lay eyes back on our Community Health Advisory Council work plan, I think we'll be able to see where this lines up with some of our action items. My goal today is to start assigning some people to kind of spearhead some of our action items in our work plan. And yes, thank you, Alex. There's some things that are currently happening and some things that I think we would need to do first before we move into some of our other action items. And a lot of that is around assessment, resource mapping, figuring out what does and doesn't exist around resources. Camille mentioned that we'd love to see a space for community health workers that are in Crook County to exchange ideas and do some case consultation and things like that. That might already exist in maybe another space that we're just not aware of. So part of this assessment is figuring out ways to make sure that we're not duplicating efforts and that maybe we can use an existing space to provide some of these resources and supports that we just didn't know existed. Or if there truly is a gap, figuring out how we might be able to build something out if that's needed. So our first goal is around social drivers of health, those things like food, transportation, housing that affect people's ability to lead healthy lives. And our first goal there is around developing a resource map, a resource hub. So Camille identified that as some place where all of these resources live and are distributed out in one space, figuring out how we might be able to maintain that, because that tends to be the biggest hurdle, is who is going to keep this up to date and oversee it and make sure that it's current. So that inventorying of resources that do currently exist is that first piece that we need to do before we can move on and do anything else. We have talked about the fact that there's some of this work is already happening with Central Oregon Health Council and Central Oregon Community College. Is that correct? Yeah, okay. So we know that there is some movement happening, but we want to make sure that we, as a group that is really rooted, those are both regional entities, right, doing this work. So we want to make sure that those of us who are here in Crook County providing these services are informing that work and driving that work on behalf of here in Crook County. So I would love to be able to assign, we need to have an appointed Community Health Advisory Council member who isn't necessarily responsible for doing these things, but responsible for working alongside our staff who are doing these things and then able to report it back to this group. I'm going to give an example, and just because Alex said Devin's name, so Devin has some kind of connection with this work, this assessment work that's happening already. It could be that Devin is our CHAC appointed member who is in that responsible column. And ideally it is people who it makes the most sense. Like, we're already doing this work, we already have some touch points. And again, it doesn't mean that we have to do it. It's just that we're the connection between the work that's happening and this group here. So it might make sense that Devin is that point person because she's already had some connection with that assessment work that's happening. The other one, or the next one that, oh, Devin, you are such a gem. Thank you for entertaining me. The next one that, so there's a couple here, like I said, that are still in white. We don't necessarily have to assign anybody to those right now because we're not going to start those until we have that assessment piece done. Goal 1B1 is around partnerships and some of the meetings and work, again, that's already happening to bring resources to the county, but making sure that we as a group are aware of those and that the work that we do to make our community aware of those things, that there's a clear who's doing what pathway. So we know that people are already participating in regional meetings around things like childcare, behavioral health access. Like, there's all these work groups that meet all the time that talk about access to care in Crook County. But we would need someone to kind of compile that and bring it back to this group. I will go ahead, I'll volunteer myself. And if somebody else would like to do that with me, that's totally fine. But I'll volunteer myself for that one just because I do tend to sit on several of those meetings already. And so I can champion that for us. Unless somebody opposes and really wants it from me. The next one is around identifying barriers to local service delivery. That's some of the work that we've talked about in this space, but we haven't really talked to partners outside of this space about barriers. And so we want to be able to do some work to do some additional barrier identification. Some of that has come up around an issue of space. I know that came up, I believe, I don't know if Hope's on the call today, but that was brought up of like, providers want to be here, they just don't have space to be able to have an office or to convene meetings. Right now we have a counselor from the vet center in Bend who comes and provides therapy, direct therapy, and one-on-one and group therapy here. They meet in a conference room in a county building, which is not a therapeutic space. It works for group to an extent, but there is a dynamic of like, we don't have good space for providers who do want to be here and can provide services. They're running into that barrier space. We've also heard that in relationship to childcare, where folks have wanted to bring in a daycare and can't find the real estate to be able to stand that up. So this particular action item is somebody who can, again, not necessarily do it, but work with staff and partners to identify those barriers. Why are people having trouble delivering services here in Crook County? Do we have staff either in the room or online who are doing some of that work right now? I'm looking at my team in particular, but
I mean, we have conversations and meetings sometimes.
but nothing necessarily formalized. Yeah. Is there an appointed CHAC member who would like to be a point person for this barrier assessment?
I will. I'm already on an action plan for transportation, so I might as well expand my action plan.
Thank you, April. You'll have help.
Well, talk to Rita. She has a meeting today with St. Charles to discuss barriers with the OB care.
I was gonna say, like, I'm
Yeah.
happy to be on that, but I'm so like tunnel vision on healthcare. Like, it's hard to think outside the box where I'm like, I know the barriers on our side, but
yeah,
I can't think of like the other. So I'm happy to be a part of that.
Well, I think that's where, and we'll talk about what staff support looks like for these things too. Is we're going to have to do some outreach to partners. And so we can help facilitate those conversations. Like, we're going to want to talk to you in St. Charles about what some of the barriers are that you're running into. But also, we're going to talk with places like Neighbor Impact and Thrive and other providers here locally that just to find out, and community members of what are their challenges and what do they want to see that we're not able to provide. That's it for that one.
I just messaged someone because I know we're a part of a meeting. And I was told, yes, we are with community partners. It happens monthly. And it's with EMS, fire, PD, sheriff's office, Airlink, Life Flight, the health department. And it's about like high risk cases or people in the community that might need additional resources. So I don't know the details of that.
I go to that one.
Sorry, I thought you were talking about the ED community.
Several of the people you listed are not in that. It's sometimes EMS is there. Rarely is anyone from PD or sheriff's office there.
Okay.
There's usually people from St. Charles. There's a lot of people that work with the organization that runs it that I can't remember. But they're only working with high risk people, and it's not every day kind of people.
Gotcha. Okay.
And so it's very limited in the population that they're talking about.
Gotcha.
Yeah.
Okay.
And I think there are groups like that meet regularly and have some overlap, and so it'll be good to identify what maybe in theory are spaces that we could convene. And I mean, it's similar to this group. We have folks that are shown as being as representing, but have a hard time making it to meetings, and so we don't always have their voice. So I think that's the case in a lot of our groups. We're all wearing so many hats and spread a little bit thin. Okay, so we're in goal number 2 is around access to care. And the goal that we are working on is developing and implementing a coordinated system for sharing healthcare information across platforms or partner organizations. So again, so that people are aware of resources that are available to them here. We're not trying to create anything new. It's just increase awareness of what currently exists and making sure that people are connected to those resources. And this is connected to that, like, what have we been calling it? A hub, a resource hub. But are there existing communication platforms like, I don't know if it's billboards, or I keep thinking about the chamber newsletter that goes out and everybody can chamber members can attach their PDF files at the end of the email. are there existing communication channels that have good reach that we can leverage? Or do we truly need to create something new? I don't know. I kind of hope not. But we have to assess it first. So this could be a fairly simple action item to identify what exists and what is or isn't working. So is there anybody that any appointed members that feel especially passionate about how we're communicating out resources? That could run point on that. I cannot do it, but.
Good job saying no. Last call.
Well, it'll be last call in an open space. We will reach out to folks behind the scenes if we don't get folks in the meeting, and that is totally fine. Especially if you're not sure of your capacity right now, we can work with you on that. What's the next one in? Do we have one more that we were gonna? No, that was the only one for access to care. And again, it's really because we have to do that assessment piece before we can move on to the other ones. So in prevention and recovery, again, we have some assessment work that we need to do. And that first one is around partner engagement. So the goal is collaborating with partners to, again, it's an information hub so that community is aware of events, activities, and resources that are supportive of both recovery and prevention efforts. So this would involve partner connection. And we do have we do have staff support. I think Haley is on the call as a health department staff member. There's quite a few folks I know in public health, and I would imagine in the behavioral health space as well that are already doing this connection work. But if there's an appointed member who can be our point person for bringing that back to the group, that would be lovely. That's partner engagement. Seeing them like jumping up and tackling that one, that is all right. Like I said, we'll do some behind the scenes work after these meetings. The other one is around community interest and gaps. So maybe things that people would like to see more of in this prevention and recovery space. And again, I think that's one that our staff are doing fairly regularly, this type of work. So the CHAC member who would be assigned to this one would have staff support that's already doing this. And again, just bring it back to the group. So if there's interest in that assessment piece with partners around prevention and recovery resources. I feel like we've had a wall, folks.
Can I ask a question?
Yes.
Do you have to be a member to be responsible for an activity?
Yes. So assigned in the CHAC work plan, yes. I believe that Alex, if you scroll up, there's columns. Oh no, we talked about adding it.
So it'll essentially look like this, like Courtney, and then I have to do all my fancy, stupid stuff to make it work, and then it will be like support staff, Alex. So it'll say that in this box. So me and Riley might be the ones doing a lot of the work, but instead of communicating to a bunch of people and us trying to come to all these meetings, but we're not supposed to have as much to say, it's mostly members. We're going to communicate what we're finding to Courtney, and then Courtney will come to these meetings and report out on the work that's being done. So it's not necessarily that the lead is doing all the work, but a member has to be the lead.
Gotcha.
Yeah.
Thank you.
Have to be assigned something. So we feel like, I think they should just say,
Yeah. And
like
well, I mean, I think what Alex and I will do is after this, part of this is just making people aware of here's kind of the first steps and the things that we're going to be working on first, and then how we're going to structure the work, so that we're all aware. And then if there aren't folks that immediately are like, oh yes, that's absolutely me, I want that one, we'll come back and talk to our appointed members and see if there's a good fit for any of you. Oh, yep. Thanks. So
Are there open spaces still for members?
Yes.
yes, we are still, I don't think we have an open recruitment right now.
But we should.
Yeah, somebody was asking me if somebody from Rimrock was.
Yeah, I think we have at least two or three. Mm-hmm. Yeah, because Tom, our veterans rep or community member, moved out of the area. So yeah, we do have a couple and we'll be recruiting for additional members. Thank you, Hope. So we've got Hope assigned to 3B1. Is there another one right below 3B2?
Oh, sorry, I thought you were
in the workplace
message.
No.
Yes, there is.
So this one is check as a group, supporting events that are already happening. One example that I think of in this one is we have a Recovery Month event that several partners, the health department, Best Care, Rimrock, several partners are already engaged in and doing. And so this formalizes our support of those events that already exist and report out if there's any needs to actually implement those events to this group. What's the last one, Alex? So this is similar to the community health worker convening that Camille mentioned in the Rural Health Transformation Project work plan. This is a partner meeting specific to prevention and recovery. Am I correct? Am I remembering this right? Okay. That might already exist. I don't know. I know that it exists in certain spaces, like our prevention staff have prevention meetings, but it's not necessarily with partners in one space.
Yeah, I think there's multiple meetings happening, but it would be cool if we could find a way to bring all those together.
Or have a space carved out, maybe in an existing meetings where there's a standing time and space for those conversations to happen. Mm-hmm. Creation of a meeting, that's like a one and done, you guys. If somebody wants that one.
Sounds like it.
It sounds like it. It sounds like it. It's true. Okay. Are there any others for this one, Alex? I think that's the only one. Okay. So folks can think about it. Alex and I will follow up on filling out the remaining ones for having an appointed member running point on these. And then the next step for this work plan as a whole is to go in front of the Board of Commissioners and share out with them what we're thinking, and they will formally adopt it on behalf of the county. So that will be coming up so our next meeting is in August, I believe. So by August, our work plan will have been adopted by the county officially. And then it's a live document. So as we work through it, as we, maybe our staff are working on some of these things and we run into something where we're like, this isn't feasible or it's no longer needed, or we need to change it and do something else. That's totally fine. We can adapt and adjust as we go. So the goal is that we're bringing this back on a regular cadence, updates with the group, asking for feedback, and we can revise it in real time as we're going. Well, we are cruising because that is my last agenda item for us. We do, Alex, do you want to talk about our future?
Real meetings, Haley's
Oh,
asking if you
sure.
can share information on the funds the county might receive for the RHDP work.
Yes, Haley, do you have a specific question about the funds?
Sorry, can you hear me?
I can.
Okay, cool. Yeah, I was just curious if we knew how much we were going to receive as part of that work, or if we had that written out in the proposal already.
We do. The budget is it's what's under it's what's going in front of the commissioners tomorrow or
Okay.
Wednesday for approval. But the breakdown of the budget, it all goes to staffing. So it will designate staffing within local public health to do the work that Camille described, to facilitate some of those community convenings, the classes, and the outreach. So we'll be able to designate staff time again to do some of this assessment work, so that appointed members don't necessarily have to make that lift. Does that answer your question, Haley?
Yes, thank you.
Okay. There's additional, so the Board of Commissioners meeting is public, and I believe the contracted amount, I don't know it off the top of my head. Camille, do you? It's 200. It's right around $200,000 that we will be able to spend from July 1 until June 30 of 2027.
Be concerned that this is like a one-time and that we might not get.
Absolutely.
Yeah. It's just hard to like build up staff with like a one-time and then like, okay, what if we don't? What if we don't?
And part of that is we're not hiring any new staff. We're building this into folks that are already on staff and doing this work. So yes, it's absolutely a possibility that the funding won't exist next year, but we'll help for this year. Yeah, we'll find other money because we're scrappy.
Okay.
Yeah, good question. Okay, now, are there any other questions before Alex talks about future topics? Alrighty.
So in August, we're gonna have a guest presenter from OHSU. I think a lot of you know Caitlin Green, but it's her coworker, I think her name is Paige. They're currently doing research to compile information on cancer data. So they have a presentation and a discussion that we'll have afterwards. And they've just really been wanting to come in front of this group, knowing that we're all part of community health in some way, shape, or form. I don't know much else about it, but they're really looking forward to it. And we've been trying to get them in here for like 8 months. So we're finally getting it.
And I'm sorry, do we know where that one will be located?
It's gonna be, I have it all on a whiteboard in my office. It'll either be at Best Care or the health department. I can't remember which one it is though. Yeah.
If there's anything else that you all, if you want guest presenters to come into future meetings, or if you have connections with organizations that, I mean, maybe as we're getting through our work plan, we might want to bring service providers in but present to this group. So if you have a connection with somebody, or if you don't have a connection and you would like one, let Alex or I know, let any of our staff, and we can work on getting that scheduled out.
And Grant also just shared that this is his last meeting. He's accepted a new job at Jeffco. And good luck with all of this work. So we can all say bye to Grant.
Thank you. Yes, thank you for your time with us, and congratulations. I hope that's a good move for you. We'll definitely miss you here. I had another thought with future topics and I lost it. Oh, it's around OHSU. So I was have been invited to serve on an advisory council for OHSU, and I think it's related to their cancer plan that they're doing statewide. They're going to be hiring, and I'm not going to get the title exactly, but they're basically service navigators specifically related to cancer treatment and all related things. So they're going to actually start rolling that program out in Eastern Oregon, which is really encouraging to see because most of our resources live on the other side of the state. But they're recruiting for folks who are here living rurally and representing rural communities to advise that work, at least to start with. So I'll be able to bring that back to this group too once we start meeting. I think we have quarterly meetings, so it's not a huge time commitment, but I'll be able to share out once they start hiring those navigators and which communities they'll be working in and with. But that's exciting as far as when we're talking about access to care and resources that are available to people needing care in Crook County. That could be a good opportunity. Didn't I say I was representing one of those in one of the action items that I'm attending? I'll be attending meetings and bringing it back to you all. Alrighty, next meeting again is August 3rd. Alex will send out our physical location. We will always be available, have this online option as well. And if you need anything in the meantime, let us know. We'll be reaching out to you for work plan assignments. So thank you for being here today. Good to see you all. We'll see you next time. Bye, everyone. Bye.